Hello everyone, welcome to sqadia.com. This is Dr. Sana Khan with the General Surgery course. We have been discussing about the vascular part of the general surgery, and so far we have discussed about some of the diseases associated with the venous disorder, and we also try to discuss and cover the arterial part of the vascular surgery. And for the past couple of lectures we have been discussing about the lymphatic channels, and in the previous lecture we discussed about the primary and the secondary lymphedema and some of the acute conditions which are related to the lymphedema. But in today's lecture, we'll be talking more precisely about the investigations you need to order for the lymphedema, for the diagnosis, for the severity of the an assessment of the severity of the lymphedema, and then obviously how to differentiate between a malignant and a non-malignant one. And at the end, we'll be talking about some management strategies as well. So, just having a look upon the outline of today's lecture, first of all, you need to know, are investigations really necessary when you're investigating a case of the lymphedema? Usually, lymphedema diagnosis is based on history, good history and a good examination, right? But sometimes, if you need to differentiate the causes, it's a primary or the secondary one, then obviously you need some of the investigations. So in today's lecture, we'll be talking about what kind of the general investigation and what kind of the specific investigations we're going to order for that. We'll be talking about the role of the routine investigation in the diagnosis for the lymphedema. If we talk about the specific investigations, then what kind of the investigations we need to order specifically for the lymphedema. Especially we'll be talking about the lymphangiography, the information we are getting from lymphangiography. We'll be talking about the technique which is called as the isotope lymphoscintigraphy, and we'll be talking in detail how it is performed and what kind of the isotope is being used and how it's going to give you the details about the lymphatic channels. Other than that, we'll be talking about the CT, and we'll be talking about some of the investigations and some of the important information a CT is going to give us. We'll be talking about the magnetic resonance imaging, and ultimately we'll be talking about the role of the fine needle aspiration cytology and biopsy when we're investigating a case of lymphedema. Other than that, obviously, how would you actually assess the response on what the patient treatment and what the patient has been put on? So for that, you need to order for the limb volume measurement. We will tell you in detail how it's going to help you. Then at the end, we'll be talking in detail about the management, the conservative management and the surgical management of the lymphedema. How we're going to control the pain, how we control the swelling, how we're going to control care about the skin conditions, what is the role of the exercise in that, and some kind of the drugs. Then regarding the manual lymphatic drainage, few of the things will be discussed in today's lecture. Other than that, we'll be talking about the bypass procedures, how the liposuction is going to help you in this case. And at the end, we'll be talking about the limb reduction procedures in case of the advanced, and how and when, what kind of indications are there in which the limb reduction procedures are being actually performed in that. So there are other couple of lectures on our website, which is sqadia.com. You can always go there, get access, and enjoy our lectures. For the detailed lecture, keep watching sqadia.com with Dr. Sana Khan General Surgery course.